Global South countries did get one benefit from the COVID-19 pandemic. A professor at St. George's University in Grenada describes it as the pandemic's silver lining. He was referring to the dissemination of the next generation genomic sequencing technology used worldwide to identify, track, and trace the numerous variants of the SARS-CoV-2 virus. Here in the Caribbean, as in Africa and elsewhere, researchers and scientists have been eagerly harnessing the technology to develop resilience and greater self-sufficiency in numerous fields, ranging from health surveillance to agriculture and beyond. I am IPS Caribbean correspondent Joel Fraser, and in this podcast, I speak with Professor Dr. Martin Ford at St. George's University in Grenada about a research paper published in The Lancet that he co-authored looking at the Caribbean's use of genomic sequencing technology. For full disclosure, this interview was recorded early in 2023, so there may have been new developments since. Also, the paper Dr. Ford and his colleagues authored relied solely on the data available in the GISAID database.
Hi, my name is Dr. Martin Ford. I am a professor in environmental and occupational health at the Department of Public Health and Preventive Medicine at St. George's University in Grenada.
Thank you. So what I'm going to ask you to do is just briefly to get an overview of the paper that you published in the Lancet and the key takeaways. Then we're going to drill down into some of the questions that were brought up in the paper.
Okay. The paper that colleagues and myself published recently in the Lancet was looking at an issue with respect to our ability to do proper health surveillance of this novel pathogen, the SARS-CoV-2 virus that causes COVID-19. If there's a silver lining that came out of this pandemic was that it brought to the Caribbean region technologies and tools that previously we did not have. And one of those tools that has proven to be very important, almost indispensable in doing surveillance of any disease, any pathogen, is next-generation sequencing. Next-generation sequencing is a powerful tool that enables one to be able to see how a virus pathogen evolves, how it changes, mutates, thereby affecting whether it becomes more transmissible, how it impacts on your current treatment modalities, whether they remain effective or become less effective. And so we wanted to see whether the Caribbean region was able to use this new technology effectively or whether it existed in the first place. And so given that we, when looking at the data, found very little evidence, it was the genesis for writing a paper to exhaustively look within the Caribbean. We focused on the Caribbean islands, the Caribbean countries, and looked at whether this technology was present and how much of it was being used. And we found that very little was being used at the time period in which this study was conducted. But since then, we're seeing that more and more countries are adopting this technology, and we wanted to promote that trend because of the impact it can have on making our health systems more robust and more effective in dealing with today it's COVID, tomorrow it might be something else. So that was the reason behind driving the writing of this paper.
Thank you. So your paper spoke specifically to the question of how the GDP of countries as well as the political status, whether they were sovereign states or whether they were dependencies, is the effect that their GDP and their political status had on their ability to employ the technology, to make use of it. Could you just explain, please?
Yes, certainly. So we were trying to figure out why, for example, is next generation sequencing not available universally throughout the Caribbean. The answer to that is that because it's new, it requires certain technologies and certain capabilities. So that answers the first question as to why this is not universally present currently within all Caribbean islands. It has started to come in. And so we're trying to figure out why is it coming into some regions or some islands and not others. And so we looked at a number of factors. One, for example, is GDP. Is it related to the status of a country's economic status of a country? We found that when we looked at how many cases were sequenced and compared to the island's GDP, there was no significant relationship between those two variables. We looked at then political status, and how we did that was looking at, for example, whether a island's was a dependent territory, meaning that they were still a colony, for example, of a European country, whether that be Britain, France, or a Dutch island, or integrated, meaning that they are still in some ways connected to a bigger country. So we have within the Caribbean region, we have Puerto Rico, which is in the Caribbean, but still politically connected to the United States. So we looked at those territories. Used that as a variable to see if that might explain why some regions had greater use of this technology versus independent islands. So many of the islands in the Caribbean are now fully independent. And when we did that, we found that if you looked at how many sequences, or firstly, the presence of the technology was more likely to be in dependent or integrated areas. And if we looked at the proportion of COVID cases that were sequenced, we had about 2%. That compared to when you looked at the sovereign, the fully independent Caribbean islands, where only 0.4% of the cases were sequenced. So there was a 5-fold difference in how, firstly, the presence of the technology and how many cases were analyzed between the fully independent Caribbean countries and the countries that are still dependent or connected in some way to a bigger economy or a bigger country, the United States, England, France, the two big Caribbean islands of Guadeloupe and Martinique are effectively still parts of France. And so it seems to suggest that those countries, the dependent or still in some way connected to an external country, benefited from both resources and capabilities that they were able to get.
In terms of the data you've collected about the various islands and so on, did you see any significance in terms of the data, the sequencing data collected? Did you see any relationship between the data collected and the handling of the pandemic in any of the countries or the response? I was under the impression from something someone said that Grenada was able to use, sequencing to help it in determining how to handle its pandemic. But you can correct me if I'm wrong.
Yes. Overall, of the cases that were found or documented within the Caribbean, only about 1% of those positive COVID cases were sequenced. So 1%. And so we looked at now looking at, again, whether a country's political status, whether that rate of how many COVID-19 cases were sequenced changed or varied based on political status. We found that if we looked at the dependent territories and integrated areas, so that would be like your Puerto Ricos, your Guadeloupes, your Martiniques, the proportion of cases sequenced was 2%, so double the overall rate. Looking at the fully independent sovereign islands, the proportion of cases that were sequenced was only 0.4%. So there is a fivefold difference between the proportion of cases sequenced as well as the average proportion of cases sequenced per island. So what was driving that? What we found is that the islands that still have connections with the previous colonizers, whether that be France or England, or in the case of Puerto Rico and the U.S. Virgin Islands, the United States, they had access to resources that would allow them to sequence a larger percentage or proportion of the COVID cases. That they had firstly the resources, or they had access to labs, whether that be in France or in the United States, on the continent, where they could have those samples analyzed and sequenced to determine what type. And so based on the variant would determine how likely the virus would spread, how likely the vaccine would work. And so that's, again, just driving the point that in the islands that did have this technology, they were able to have a window into the spread of that virus, which variant, therefore which treatments are more likely going to be effective, and therefore have a more effective public health response compared to those islands that lacked that tool and therefore were not able to be able to adjust, tweak their public health approaches as the virus or the pandemic progressed.
Can you identify any particular islands, say also still that are still dependencies or integrated, that were able to manage the pandemic better because of having more sequencing data? Can you give me an example?
For example, in Grenada, we were able to do next generation sequencing. We were able to identify quicker, for example, when the new variant Omicron was starting to spread, what proportion of positive samples were due to the Omicron variant. It became known that the Omicron variant is more transmissible and the vaccine has less of an effect in terms of preventing infection compared to the previous variants. When you have that level of information, as we did, for example, here in Grenada, you then know what treatments you can use, which ones are not going to be effective or as effective as they were with previous variants. That is the utility. That is the power of being able to know, so to speak, what you're up against. The more knowledge you have, the more effective your treatments can be. And it can also help, for example, in evaluating your intervention to know where to direct their limited resources in trying to change the trajectory of the virus or the pandemic.
Grenada is an independent country, correct? If I'm not mistaken. So just give me a little bit of background about the Grenada sequencing. So my question is, since Grenada does not have access to outside resources, if there was a little information on what was its position in terms of its sequencing in comparison to other independent countries like Trinidad or Barbados? So did they have higher rates of genomic sequencing in Grenada? And how long have you had a culture of a practice of genomic sequencing in Grenada? I read in your paper you said that after that it was in recent times that you set up a full sequencing lab or something like that.
Grenada is a bit of a unique situation in this whole story of genomic sequencing within the Caribbean. Grenada acquired next generation sequencing technology through the presence of St. George's University, which is located in Grenada. St. George's University acquired that technology. And because of the very close relationship between St. George's University, and the government, the Ministry of Health here in Grenada, the government was able to benefit from us being able to have that technology to sequence all COVID positive cases. So there was that very nice collaboration between St. George's University and the government that provided the government the ability to have that information on which variants were present, which ones were becoming more present because of that collaboration between St. George's University and the government. And so there's two parts to this story. One, there is a worldwide body, GISAID, which acts as a repository. The GISAID stands for the Global Initiative on Sharing Avian Influenza Data, where different countries report that sequencing data to this body so that the world at large has access to it. Grenada, up to now, has not yet reported, or very little has been reported of their sequencing data to this repository. So while we used GISAID to determine how much sequencing was done within the Caribbean region, we could only report on what was uploaded. And if a country such as Grenada does not upload that data, it may give the wrong impression that that information is not available to the region. So in the case of Grenada, we do have sequencing of COVID samples. That information is released and shared with the government of Grenada, and they then use it in their surveillance activities as well as their intervention activities to determine what interventions are necessary. Grenada is a unique story, one that illustrates two things. One, using this technology requires resources. This is a good example of public-private partnerships where the private entity, a university, has a relationship with the government and is able to help the government in gaining information or access to technology that maybe they cannot readily access otherwise. That's the first part. The second part is that when you have that technology and that information, if it's not reported where it can be shared by others, then it does not provide, again, help global investigators who are looking, again, when you have a pandemic, this is affecting the world, you need as much information as you can from all parts of the world. And so from a global perspective, the Caribbean appears to be a blind spot where we don't have information, which may not entirely be true because information may exist, as is the example of Grenada, but it's not being put out there. That's the importance of using these global bodies such as GISAID to report our findings once we have captured it so that we can better plan and better intervene in trying to ameliorate or stop the track of a particular virus.
Thank you. So I have two final questions for you. One, in Grenada, are you at St. George's University, are you using genomic sequencing in any capacity right now in terms of One Health measures, trying to track, see if there's anything out there in the environment that might be developing, or even trying to detect if you have any antimicrobial resistant strains around? Are you using it for wastewater testing? And the second question is the importance of developing capacity in genomic sequencing in the region and where that's heading right now for the region.
Next generation sequencing is a technology that allows you to rapidly and at a very sensitive resolution detect multiple pathogens. So not only viruses, could be bacteria, parasites. From a wide range of clinical samples. So again, the COVID-19 pandemic, if there is a silver lining, one silver lining is that it brought this technology to several Caribbean countries. And the goal of our paper was to show why the utility of this very powerful tool should be spread to all Caribbean islands. Because not only can you, for example, detect viruses, you can detect bacteria, parasites, and other pathogens early. And so we are using, for example, at St. George's University, we have researchers now using this technology to look at wastewater samples as part of our surveillance to determine whether we can use COVID-19 as an example is still present, what variants are present, but you can use it for other pathogens. We have here at St. George's University a vet school that various researchers are looking at the rabies virus in bats and using that as also a way to see if there's changes. So these are just some examples of how we're using next generation sequencing to track or to provide early warnings. And there are others that are coming on stream. Again, each new virus, each new pathogen, each new bacteria requires its own specific reagents. And so there is some level of resources that one needs to obtain to do that. But the technology now allows us to do these things that in the past we were not able to do, and thereby able to get information a lot more rapidly as opposed to the past where we were not even able to get it in the first place. There needs to be resources that are dedicated toward this. So PAHO has been at the forefront of trying to get the region to develop this indigenous capacity. We have CARPHA, Caribbean Public Health Agency, located or headquartered in Trinidad, that also is playing a very active role. And so in part, it also comes down to each individual island seeing the utility and hopefully that this is not a luxury, but a necessity in order to have a surveillance system that is responsive to the various dangers that are going to come in the future, not if, but when. And so there needs to be, I think, an understanding and a sense of urgency among all ministries of health within the Caribbean region that they need to develop a robust surveillance system. You can't fight what you do not know. And sequencing is a technology that allows you to be far more effective, not only in determining what you're fighting, but also what interventions are likely to work and which ones are not likely going to work. So really, the goal of this paper was to highlight that this is a technology that should be rapidly adopted and spread throughout the whole of the Caribbean.
Thank you for listening. This was Jewel Fraser for IPS, speaking with Professor Dr. Martin Ford at St. George's University in Grenada.